Well, we're moving on. Actually, Abby, can I give you those flowers? Because I've just got another interview to do today, and this is very, very important. Good morning, Stav. Listen, new research, you've got to listen up here if you're a parent. It is okay to let your kids eat chocolate, play computer games, skip breakfast and sleep in your bed. Whoa, now we've really scared a lot of child psychologists and so many parents to discuss this new spin on parenting. Dr. Cindy Pan. Good morning, Cindy.
Good morning, Kerry. How are you?
Well, it does scare a lot of people, so put it in context. What are you shooting for here?
Well, I guess it's a question of not necessarily having to be really rigid and didactic about all these aspects of parenting. There are two sides to every story. There are many ways to skin a cat, and there are some instances where actually loosening up on some of these rigid rules is actually beneficial, both for children and their parents.
Okay, getting specific, the sleeping in beds. Look, we discussed this the other day, and, you know, some parents have a lot of trouble. Once they let it happen once, it happens night after night. This is a big issue, so you saying it's okay worries people.
Okay, well, what it's really about is having harmony at bedtime. And we know for a fact that while in the Western world solitary sleeping is considered ideal or the holy grail, in countries where co-sleeping is considered the norm or even de rigueur, or maybe it's a practical necessity because there's only one bed in the household, there are no sleeping problems, whereas in the Western world it's one of the most common and pressing problems in paediatric practice. And the studies actually show that there are a lot of advantages to co-sleeping, such as promoting closeness and enhancing the mother-child attachment, which actually leads to the children having greater competence and finally greater independence. And so there are actually a lot of pros as well as the cons. But in each individual household, in each individual situation, it's a question of balancing the pros and the cons and working out what really works for you as a family.
Okay, so you say it's okay if that's what you want to do. For those who can't break the habit, it's tough. Let's look at breakfast. I mean, breakfast is one of the most important meals of the day. Saying or allowing them to skip breakfast, doesn't that set bad examples for the rest of their life?
Well, I think what it is about is you want your children to eat regular, nutritious, balanced meals. The exact precise timing of those meals is not the most important thing. Obviously, for most people, you wake up in the morning, you actually have the urge to eat, and when you have the urge to eat, that is when it is the right time to eat. But in some cases, it varies. Like some people, they can't look at food first thing in the morning, they really can't bear to eat. And for that minority of people, sometimes it can be counterproductive to force them to eat when they really just don't want to eat. But also what really matters as well is the actual nutrient composition and volume of food eaten anyway, as well as a whole lot of other factors. But what the studies actually show is that depending on whether the child is generally well nourished or nutritionally deficient in the first place, that's the most important thing. If they're well nourished generally, then the exact timing of the first meal doesn't really matter. Whenever you break your fast, in other words, whenever you eat first thing in the day, that is actually breakfast. It doesn't matter exactly that occurs at a specific time.
A lot of what I've read you're suggesting is kids having a bit more freedom rather than rigid rules.
Exactly.
But sometimes, do you think there's a danger of naive young parents taking this as their new Bible and not setting great examples for their kids to learn good behaviour for the rest of it? Sometimes you just got to make a kid do what they've got to do.
Absolutely.
Not because they like it, because it's good for them.
I think it's about finding a balance. It's got to be something that works for the child and the parent and the family as a whole. So it might be that the child doesn't really want to eat at that particular time, but if they don't eat then you know, it makes it very difficult for the whole family. So it's about finding that balance, and what you really want to have is harmony. But I think what it is about the parents finding a balance within their household so that they're meeting the needs of the members of the household and the needs of the child, but not necessarily meeting the needs of this kind of spectator, third-person authority figure that, you know,
be flexible.
Exactly,
Life
be flexible. Yeah, and do what works for you. And as long as it's not going to damage the child, as long as there's no research to show that it damages the child, then it's all right. You don't have to necessarily follow any rigid rule book or necessarily do what your parents did or what your neighbours do or what your concept of ideal parenting is.
Well, on that note, Cindy, thank you very much. It is, you know, the new age thinking. If it works for people, if they're happy, go for it. Good morning.
Thank you.
Okay.